Well, all Hoosiers 16 and older have been eligible to receive COVID-19 vaccines for a month now. But as Mitch Legan reports, the rate of vaccinations across the state is slowing, especially in rural areas, and officials are becoming concerned about hesitancy by many to get the vaccine.
Getting a coronavirus shot is easier than it's ever been, but in many areas around the state, demand is falling off.
We used to have people begging to get on the wait list. We can't get anybody.
Steve Lyday spent most of April preparing what would have been Morgan County's largest vaccination clinic. The state provided 1,200 doses, and he was excited to offer residents the opportunity to protect themselves from COVID. But when the opportunity came, they weren't interested. The county had to cancel the clinic scheduled for last weekend.
We got looking at how many people signed up, and there was only 97 people. I had 40 medical professionals and volunteers going to show up just to conduct this clinic.
Despite the cancellation in Morgan County, the state passed an important milestone this week. A third of Hoosiers 16 and older are fully vaccinated. But Lyday says now he's not doing as many initial shots.
Mostly our people coming through are those receiving their second dose of Moderna. Very, very low percentage there for their first vaccines.
State health officials organized a news conference Wednesday to provide updates on the vaccine rollout and discuss trends.
We don't have any big announcements, just a lot of really good information to share, and a plea and an ask that you help everyone that you know in your family, your friends, and your community to get out there and get vaccinated.
The issue? Many of those who originally got the vaccine were older adults, most concerned about the virus. Now, many of those left are younger Hoosiers, and they don't seem to be very interested in getting the vaccine.
There's still this sense of invincibility in younger adults. You know, either they've scheduled it and they haven't gone yet, or they're still kind of waiting it out.
Handel says now, many of the people hospitalized with COVID that he's seeing are in their 20s and 30s. Brian Dixon has been tracking COVID data all pandemic and says two populations have been the wariest of getting vaccinated: young blacks and young conservatives. Considering the state's demographic makeup, that could be an issue.
Well, it is concerning, particularly for individuals who are in rural areas where we know that those areas also have a majority of people who lean conservative.
In largely rural Morgan County, Lyday says trust in the vaccine has plummeted.
When they've hit the pause on the Johnson & Johnson, the bottom just fell out.
Now, those working the clinic in Martinsville end their days scouring Facebook for people who want the shot. It's largely been effective, but Lyday's concerned many of those who want a vaccine have already gotten one.
We've hit a wall, and getting the trust back is beyond the local health departments. Morgan County and Shelby County, we don't have the financial resources like the other health departments do to run public service campaigns.
State officials said Wednesday they're doing everything they can to encourage people to get vaccinated and are actively working to increase rural participation.
We are working with the Rural Health Association, with Purdue Extensions and Farm Bureau to determine how we can work together to increase that vaccination rate in our rural population.
The slowdown concerns Dixon, but he wouldn't say the state has hit a wall yet. He was expecting a lull considering the mass rush at the beginning when people were scheduling shots months out.
If you have some hot new product on the market, people rush into the stores to buy it, and then after it's been on the market for a few months, you start to see declining sales. So I don't think that this phenomenon that we're observing right now is really any different than some of those other scenarios.
Hitting the proverbial wall is possible, though. He says the convenience of walk-in appointments should help, especially with younger Hoosiers. But social pressure and private businesses requiring vaccines could also be keys to getting back to normal life. For Indiana News Desk, I'm Mitch Legan.
Indiana ranks just 45th in the nation in the percentage of its population that has been fully vaccinated.